Welcome. It is Health Hacks with Mark L. White. My name is Rusty Humphreys. I'm here to just kind of guide the show as we get you into the latest, greatest technology of what's going on right now around the world. Mark L. White is here. We've got a great guest, Dr. Judson Brandeis. Mark, welcome back to the program. Always exciting when we have great board-certified urologists, isn't it? And it's that no offense, it sounds a little boring, but it's not, right?
Judd makes it interesting. I've known Judd for quite a while, and he's one person who can make urology fun.
What do you do? Okay, let's talk about why this is important, Mark. Why should we talk about this particular subject?
Well, first of all, sexual health is very important to most men. Wouldn't you agree with that, Dr. Brandeis?
Absolutely. It's what makes us men.
It's what makes us men. And Dr. Brandeis is the owner, medical director of Brandeis MD, and he's doing a lot of cool things in urology. So he's not your run-of-the-mill urologist. So it's very interesting on some of the things he's doing. And I'm so happy that you're on the show. So how's everything going, Doctor?
Oh, things are going great, Mark, and it's really a pleasure and an honor to be on Health Hacks.
Yeah, well, we're happy to have you. And I know one of the things that the way we met was you started working with us a few years ago, and you've been doing GainsWave. I guess that's a great health hack and a great place to start. If you can talk a little bit about what GainsWave is and how it helps people and how that's a health hack, that'd be great.
Absolutely. Well, I've always been kind of a gizmo person. I like new technology. And so I was one of the first in the country to use the Da Vinci surgical robot. I was one of the first in the country to use lasers to treat prostates, one of the first to use MRIs to diagnose prostate cancer. And about a year and a half ago, I heard about this GainsWave in the Urology Times. And so I flew down to Miami to see what it was all about. I met Mark, I met the team. The team at GainsWave and Mark are just amazing. And they really have done an incredible job bringing awareness to this amazing technology. This technology basically allows men who once were dependent on pills or shots for improving erectile function to basically get to the point where they no longer need pills or shots. And it's really empowering to men because men's sexual prowess or abilities are really central to the core of who men are and their self-confidence, their self-esteem, their self-worth. And so in a lot of ways, GainsWave is really giving life back to men.
I mean, doctor, that sounds too good to be true. Does it really work?
Yeah, I was very skeptical when I first heard about it as well. I said, if this works, it's going to be truly amazing. But I honestly, when I was flying down to Miami, I didn't believe that it worked. And actually, before I did my first patient, I called up Mark in a panic and said, I've been voted top urologist in the San Francisco Bay Area 5 years in a row. And if this doesn't work, it's going to ruin my reputation. So you have to promise me that this actually works. And
I promise it worked.
Came out and helped me get started. And so I'll always remember that. I really appreciate that. But as part of that, actually, I developed a supplement that I call a Firm, which is a nitric oxide booster. And what that does is it augments or supplements the effects of shockwave therapy because GainsWave basically improves the pipes. It grows new blood vessels. It clears out old blood vessels. But we also need an improved signal. And so that's kind of what Viagra does. It improves the signal that we use to generate blood flow. But the other part of that is a nitric oxide booster like a Firm, because as we age, the amount of nitric oxide in our body that we produce declines. And so the combination, I call it triple therapy of a Firm, of a PDE5 inhibitor like Viagra, and of GainsWave really boosts erectile function significantly.
Why do you think the mainstream urology community hasn't yet embraced GainsWave or this type of therapy, even though all the clinical studies shows it works?
That's a really great question. And in general, the urology and the research community is fairly conservative. And so they're waiting for a number of double-blind, placebo-controlled studies to come out and really support that. And there have been a number of placebo-controlled studies, but these things are very difficult to study. First of all, who's going to sign up to have a shockwave that's a sham shockwave to your penis? Second of all, it's you obviously know when you're going to get a shock wave if there's energy going through. And the third thing is it's really difficult to measure erectile function. And so there are a couple of things that work against being able to create a really robust, well-done study. Now, the amazing thing that I'm doing as Director of Clinical Excellence with GainsWave is we see that there are a number of studies that show it works, but the important thing is how well does it work, to raise awareness that it works, who does it work on, who doesn't it work on, what the long-term maintenance protocols are. And so I've partnered with GainsWave, and already we've signed up 35 doctors. Our goal by the end of the week is to sign up 50 doctors to enroll in what we call the SWEET study, the Shockwave Erectile Enhancement Trial. And it's a registry where we like to sign up between 2,000 and 5,000 patients who are undergoing shockwave therapy and follow them for several years. And we will be able to answer these really critically important questions of what is the actual benefit, who benefits the most, who doesn't benefit, what are the long-term maintenance protocols that we should develop, and what are the specific protocols. So say I'm 55 years old and I'm a type 1 diabetic. I've been type 1 diabetic for 20 or 30 years. Do I need 6 treatments? Do I need 12 treatments? Do I need additional treatments like a penis pump? Do I need a P-shot? And these are the critical, important questions that GainsWave as an organization is really going to help the clinical community help answer.
Can I ask a quick question, then, Mark? I'll let you back in. And that is, I'm a guy that doesn't know anything about this. I mean, I've listened to you, Dr. Brandeis. I've listened to you, Mark. What happened when you say shock therapy? I'm picturing getting some probes like from a battery, attaching them to my junk, and then you kind of give me a big zap, and it doesn't sound real pleasant. What's the truth?
Rusty, so the amazing thing is this technology actually was discovered in World War II. And so what they found was that when they dropped depth charges to blow up submarines, that the blast effect or the shock wave from those explosions are what actually caused the tissue damage. And so the exterior of them was totally intact, but the inside was really torn up. And it's the energy from the blast, this intense energy, is very different from a sound wave. So a sound wave is a nice, gentle, kind of sinusoidal wave. A shock wave has what we call entropy, which is just disorder. So it's a strong pulse of energy. Now, as urologists, we actually focus that energy, and we can use that to break up kidney stones. And in orthopedics, they actually use it to stimulate wound healing and bone healing. And they use it to treat plantar fasciitis. And it really depends on the actual strength of the impulse. Now, some brave soul in Israel named Dr. Vardy, who I met for the first time the other day at the American Urologic Association meeting, started using low-intensity shockwave therapy, or what we call now GainsWave, to stimulate blood vessels in the penis. And based on studies that have been done at UCSF on rats, what we know is that there are a couple things that happen. One, there's upregulation of nerve fibers and stimulation of Schwann cells, which are a specialized type of nerve. The second thing that happens is that there's stimulation of stem cells. Stem cells are cells that can become other types of cells. They're kind of cells that replenish our body. And so when you stimulate stem cells, you can grow new blood vessels. It also stimulates the induction of nitric oxide synthase. Nitric oxide synthase helps produce nitric oxide, which I said was the signaling molecule that's essential for blood flow. And another thing that it does is it stimulates the release of VEGF, or vascular endothelial growth factor, which is a growth factor that helps us grow new blood vessels. And so there's really good scientific evidence on how this actually works. You know, unfortunately or fortunately, it's on rats. These are difficult experiments to do on humans. I mean, could you imagine doing shockwave therapy on a human and then cutting its penis off, sectioning it up, and looking at it under the microscope, Rusty? Rusty, can I sign you up for that study?
Yeah, no, next week maybe.
But you know, Rusty, if you come to San Francisco and you see a bunch of rats with no penises, you know that they've been involved in studies at UCSF.
Oh, shit. Oh, God.
How many patients have you done GainsWave on? You probably are setting the bar for that, but how many have you done them on, and who does it work best on?
Yeah, that's a great question. So we've done probably about 350 Gainswave patients. And my first 40 patients, I actually wrote up an abstract, which I presented at the Sexual Medicine Society meeting. And we showed that it increased the combination of Gainswave and a firm nitric oxide booster increased the SHIM score 5.2 points. Okay, so what does that mean? It means that a 55-year-old who's taking Viagra for the first time doesn't need to take Viagra anymore. 6 treatments, and they should be basically off Viagra. It means a 65-year-old where the Viagra doesn't work anymore, it's not working all that well, now the Viagra works really, really well. And it means that a 75-year-old that's using injection therapy has to stick a needle in his penis every time he wants to get an erection, doesn't need to stick a needle in his penis anymore because
That doesn't sound like fun.
12 Gainswave treatments. And because of that, now Viagra seems to work okay for him.
Now, you talked about like combining it with a firm. How'd you get into a firm? I think that's fascinating. Tell me a little bit about a firm.
Yeah, so when I was at UCLA, there was a Dr. Lou Ignarro, and Lou Ignarro won the Nobel Prize in 1998 for discovering nitric oxide as a second messenger. And like I said, sometimes people tell you that something works, but you actually don't really believe them. And so, you told me, oh, this Gainswave, it's great. It really does what it says it does. But to be honest, I didn't believe you. I mean, you're a nice guy, but I still didn't believe you. And so I was thinking, well, what else can I do to improve erectile function? As it turns out, if you look at the Journal of Geriatric Cardiology articles, and I may be the only urologist ever to read an article in the Journal of Geriatric Cardiology, but what you find is that for the average American, by the time they hit 50, they've lost about 50% of their nitric oxide production. And by the time they hit 70, they've lost about 75 or 80% of that nitric oxide production. And so what that means realistically is that if you think about a dimmer switch on a light, you've turned the light down 80%. And so with 20% light in a room, you probably can still walk around the room, but you can't speed read and you can't do surgery. And so by boosting nitric oxide, you're boosting blood flow. And that has effects all throughout the body. Most importantly, for us anyway, in the penis, but also nitric oxide boosting has been shown to reduce the risk of Alzheimer's, reduce the risk of dementia, reduce a lot of elite endurance athletes take nitric oxide boosters to train and to race. I've had diabetic patients say that it's improved their blood sugar, and doesn't have anything to do with the blood sugar. It has to do with better perfusion of the pancreas.
Now, diving into other sexual wellness hacks, what else can a guy do to build a stronger erection? How can a guy perform like a rock star?
Right. So I have a talk that I'm giving at the Aesthetic Show next month called Biohacking the Aging Penis. And there are 5 biohacks that I can identify for biohacking the aging penis. Now, we all know, exercise, eat right, sleep well, don't smoke, don't drink. Those are kind of the basic kind of things. But different than that, above and beyond, are something like a firm nitric oxide booster. That's something that a lot of men don't take. But I think everyone over the age of 50 should begin to replace their nitric oxide. That helps all systems in the body. Things like PDE5 inhibitors, like taking daily Cialis. Now that Cialis is generic, it's very inexpensive. At Brandeis MD, we sell it for $1 a pill, a 5 milligram Cialis tablet. So you can take that once a day. The third thing, of course, is Gainswave. Gainswave is really amazing in terms of improving blood flow to the penis. Now, a fourth thing that's really overlooked is what we call a vacuum erection device or a penis pump.
Like Austin Powers.
Exactly, like Austin Powers. But, like Austin Powers, it can give you superpowers. And I'll tell you why. So when you're younger, what happens is 3 to 6 times at night, you'll get an erection. And those erections last for about 5 or 10 minutes. And Mark, you and I fondly remember those days.
Not together.
Not together. Yeah. But what that does is it brings oxygenated blood into the penis. And the other thing it does is it stretches out the penis. And so what happens is as you get older, you get less of those nighttime erections. And the effect of that is threefold. First of all, the stretch penile length, or the length of your erection, gets shorter. The second thing that happens is because you're not getting oxygenated blood in the penis becomes very fibrotic or scarred down. And then the third thing is that the lining of the inside of the penis, called the tunica, is a very tough tissue. Okay. And the reason it's so tough is because the blood pressures in the penis get up to about 300 or 400 millimeters of mercury. So the blood pressures in the aorta, the main blood vessel in the body, they get up to about 120 over 80. You know, when you're exercising intensely, maybe they get up to 200. So the blood pressures in the penis are double what the blood pressures in the aorta are. And the aorta is about 1 millimeter thick. The penile tunica is about 2 millimeters thick. And because it's so thick, it's hard to stretch out. And the amazing thing is when God invented the penis, what he did is when the heart pumps blood, where does it go? The first place it goes is the heart, right? You get the coronary arteries. Then it goes to the brain. Then it goes to the lungs. Then it goes to the liver. Then it goes to the kidneys. Then it goes to the intestines. Then blood goes down the leg. Then what happens is it goes to what's called the internal iliac artery. And you probably don't want to know all this anatomy, but I'm getting to a point. Okay, the internal iliac artery has branches. It goes to the gluteus muscle in the buttock. It goes to the tailbone. It goes to the bladder. It goes to the prostate. It goes to the rectum. And you know, the last branch of the internal iliac artery is called the internal pudendal artery. And the internal pudendal artery becomes the penile and the deep cavernosal artery. So the very last branch of your blood flow goes to the penis. And so your heart and your vascular system really has to be well intact in order to pump blood all the way down to that last branch.
Is it true that things like erectile dysfunction mean that there's other things going on, whether it's poor blood flow in other places of your body? Is that the canary in the coal mine?
Absolutely, 100%. I mean, that's why it's important to actually go to a real doctor when you're treating erectile dysfunction, because they did a study years ago that showed that 7 years after the development of erectile dysfunction, 50% of men who had erectile dysfunction had some major cardiac event. And so if you're young and you're developing erectile dysfunction, it means those blood vessels somewhere along the line are clogged. And the blood vessels that go to the penis are about the same size as the blood vessels that go to the heart. So if you're blocking the penile blood vessels, eventually you're going to block the heart blood vessels. And so, you know, for my patients that are younger, that come in for Gainswave, and about 75-80% of the time, patients who get Gainswave will show significant improvement in erectile function. It works in a very high percentage of patients. But in those patients that it doesn't work on, I send those patients to the cardiologist, and those cardiologists get calcium scores, okay? And there are many patients of those 350 patients I've done Gainswave on where I literally have saved their lives. I literally have gotten them to a cardiologist or their primary medical doctor to take care of a problem that would have done significant damage to their myocardium if we hadn't gotten on top of that.
Well, real quick, Mark, and then you said something that I was really surprised at. You said that you actually want some men to take Cialis every day, like your daily baby aspirin. I mean, I've never heard anybody say that. Why would you want somebody taking it every day? Is it good for you?
Yeah, so PDE5 inhibitors are really amazing drugs. And Cialis has a half-life of 36 hours, so you can take it every day. So it really depends on where you are in terms of the spectrum of erectile dysfunction. But if you're really struggling to get an erection, then you'll need a combination of Gainswave, Cialis, a PDE5 inhibitor, and a vacuum erection device in order to maximize erectile function. You know, if you're 55 and your erectile function is just beginning to decline, maybe all you need is Gainswave and you're good for another 5 or 10 years. But if you're 75 and you want to maintain physical intimacy with your wife, or maybe you're divorced and you have a younger girlfriend, and these things are really important to you, then what you want to do is to maximize your ability to be confident in bed. And see, that's another issue, is the confidence. So anxiety produces stress hormones, and stress hormones work against erectile function. right? You have two systems. You have the sympathetic system and you have the parasympathetic system. So sympathetic hormones are fight or flight. Parasympathetic hormones are basically sitting around watching TV. That's where blood flow goes to your intestines, to your kidneys, to your penis. And so there's only one system. And whether you're running away from a saber-toothed tiger, or you have stress at work, or you're worried about getting an erection, it all produces the same hormones. And those hormones basically cause a reduction in blood flow to the penis.
Biggest question that comes up, no pun intended, is will this make my penis bigger? I hear that all the time. I mean, what have you seen?
Yeah, well, it will make the penis bigger in terms of being able to fill up with blood properly. And so you'll get a more full erection, but in terms of increasing the length of the penis, I don't think there's any evidence thus far that's shown that it does. But what it can do for men who are in their 60s and 70s, especially if you use a penile pump, is to restore your original penile length.
What's the biggest success story you've seen with GainsWave? I mean, what if you could share something that you never thought was possible with GainsWave? Tell me about that.
Oh yeah, well, there's so many success stories, and I'll tell you a couple of them. But I used to do general urology. I've cured so many men of cancers, taken out kidney stones, and patients come in and they're really grateful, and they pat you on the back and say thanks a lot. But it's been one of the reasons I switched over to purely men's sexual medicine is it's so gratifying. I mean, patients are so appreciative of the new life that they've given you. And one of them comes to mind. He was a 75-year-old gentleman. He'd been my patient for 15 years. I'd managed his prostate issues. And every time he came in, he was telling me about his wife who had Alzheimer's. And he was so devoted to his wife for about 10 years. And then finally she passed away. A couple years later, I saw him and he had a girlfriend. But he was having severe erectile dysfunction. And he came back to see me the next year. And finally I had GainsWave in my toolkit. And we talked about GainsWave, and I said, let's give this a shot. And after 12 treatments, he came in with this giant, I still remember as if it was yesterday. He had that like flushed kind of giddy grin that 16-year-olds get. And I said, oh, gosh, Peter, what's going on? And he said, well, I took a Cialis pill and I was physically intimate with my girlfriend for the first time in 15 years. And it was just amazing. Here we had just given this incredible gift to this man who hadn't had physical intimacy for 15 years, and he was 75 years old. And he has to this day continued to enjoy that part of his life. And so we give guys that part of the life back, and it's the kind of thing that makes life worth living.
Mm-hmm. Agreed. Now, you mentioned like younger guys. Does this work for I've heard guys in their 30s who just want to perform at their best in the bedroom? What does this do?
Yeah, so we have patients who come in more for a performance tune-up because it does increase the vascularity of the penis. And so men get, these things are a little bit more difficult to prove in a study, but anecdotally, men say that their erections are a lot firmer and that the refractory time between erections is less, and that there's better sensitivity of the penis. And the reason probably for the sensitivity is that it stimulates nerve growth fibers. And so you're probably increasing the density of nerves on the penis.
In English, refractory time means the ability to have an erection after orgasm?
Right. So after orgasm, getting an erection is a parasympathetic function. Orgasm is actually a sympathetic function, right? Because if you think about it from an evolutionary standpoint, when you're engaged in sex, you're an easy target for someone that wants to eat you. And so the best thing to do is finish sex and then get out of there. And so so you get this sympathetic outflow that causes ejaculation, and it also causes the erection to go away. But if you want to have another erection, it takes a while for your bodily system to get that going again. And by anecdotally, patients say that their refractory time, or the time between getting an erection and getting another erection, is less.
And then the sensitivity, do you see a lot of premature ejaculation? Like, what do you see with the increased sensitivity? Is there anything that they can do for that?
Yeah, people don't complain necessarily. I haven't heard the complaint anyway about premature ejaculation after GainsWave, but I just introduced a new supplement called Prelong. And Prelong is the only supplement out there for premature ejaculation. So there are very few things to do about premature ejaculation. One thing you can do is use a cream, or a spray, and basically that's a desensitizing cream or a spray. So it basically, there's less sensitivity of the penis, which, on one hand you can last longer, but on the other hand, it doesn't feel as good. The other thing you can do is you can take antidepressant medications, but who wants to be on an antidepressant medication if you don't have to? And so another thing you can do is take Prelong. So Prelong is a combination of St. John's wort and L-citrulline. So L-citrulline is a nitric oxide booster, and St. John's wort is a natural selective serotonin reuptake inhibitor. So most of the antidepressant drugs are selective serotonin reuptake inhibitors, and serotonin is a neurotransmitter. It's a chemical in your brain that is one of the things that mediates ejaculation. And when those levels go down, that's what gives people premature ejaculation. And by taking St. John's wort, you naturally increase the amount of serotonin in the brain and decrease the risk of premature ejaculation.
Let me ask you a question about the GainsWave procedure. You talk about some guys needing 5 procedures and one guy needed 12. When you get a procedure, first of all, does it hurt? And then am I out of business for a day or two? Is there recovery time or no?
No, that's the beautiful thing about GainsWave, is that there's no recovery time. Guys can go right to the gym afterwards. They can have sex that night. There's no functional downtime whatsoever from GainsWave.
Now, if somebody wanted to get GainsWave, I know they go to the GainsWave website, they find a doctor near them, but what do they do if they're interested in Affirm or Prelong? How do they go about ordering some of that?
Right, that's a great question. So at affirmscience.com, AFFIRM science.com, we sell both the GainsWave, the Affirm, and the Prelong.
And if they wanted to come visit you you're out in the Bay Area,
Absolutely.
they go to, it's brandeismd.com, is that correct?
brandeismd.com. And I love educating patients. I love educating doctors. I'm one of the doctors that teaches other doctors about how to do GainsWave, how to do P-shots. And so you can go to brandeismd.com. That's my website. I have educational videos on shockwave therapy, on GainsWave, on Affirm, on the ingredients in the Affirm, and all aspects of male sexual medicine.
Awesome. Dr. Brandeis, thank you so much for your time. We're so happy to see you on the show, and looking forward to this.
Awesome. And thank you again, Mark, for helping to sponsor the GainsWave study, the Shockwave Erectile Enhancement Trial. This is going to be absolutely amazing. It's going to really generate the knowledge and the awareness that things like GainsWave exist to improve erectile function, the biohacks for the aging penis.
Love it.
All right, if you want to find out more about both these gentlemen, and you should, go to marklwhite.com. Also, do us a favor. Would you please subscribe to Health Hacks with Mark L. White? It's available at iTunes. It's available at Stitcher, iHeartRadio, radio.com. It's going everywhere. It's growing in leaps and bounds every single week. Mark, is there any other website you'd like people to go to?
Always come to gainswave.com and learn more about GainsWave, and support our doctors, brandeismd.com.
Absolutely.
And, if you're somebody out there with an amazing health hack, you have a great story to tell, I'd love to hear about it.
All right, he's Mark L. White. That's Dr. Judson Brandeis. I'm Rusty Humphries, and this has been Health Hacks with Mark L. White.